You know that moment, that split second of panic when your dog bounds back from exploring somewhere and suddenly they're squinting or pawing at their eye?
Oh, yeah.
It's amazing how quickly things can escalate from just a normal afternoon to, well, a potential emergency.
Absolutely.
Think about those everyday things. A cat pouncing maybe a little too enthusiastically, a dog just joyfully crashing through the undergrowth,
It happens all the time.
even just a run-in with, an unexpected sharp object. These things seem minor, but they can sometimes lead to surprisingly significant eye injuries.
And that's exactly the kind of scenario we're diving into today. This deep dive is all about corneal and scleral lacerations in dogs and cats.
Okay.
We've been looking at some really informative, expert veterinary resources to get a clear picture of these injuries.
Right, so we're going way beyond just the superficial scratch here. We're talking about actual wounds to the cornea. That's the clear protective bit at the front.
You have the window of the eye.
And the sclera, the white outer part. Our goal here is to give you a solid grasp of what these lacerations are, how they happen, what the key things are to watch for, and the fundamental approaches to treatment.
Yeah, the basics.
Whether you're a devoted pet parent or maybe you work professionally with animals, this is the kind of knowledge that can make a real difference in acting swiftly and effectively if, something goes wrong.
So let's get down to the basics then. Defining these injuries. It's important, I think, to understand the distinction between a couple of key terms first.
Okay.
First, we have penetrating wounds. This is when something enters the cornea or sclera but doesn't actually go all the way through.
Like it pokes in but stops.
Exactly. Then we have perforating wounds, which are generally more serious because the object or the force completely traverses the eye wall, goes right through.
Whoa.
And these carry a significantly higher risk of vision loss.
Okay, so penetrating is in, perforating is through.
Okay.
Got it. That makes it clear. And I imagine it gets more complex from there.
Absolutely. We also differentiate between simple and complicated lacerations. A simple laceration involves only the cornea or the sclera. The other structures inside the eye are okay.
Right.
A complicated laceration, however, is always perforating and involves other parts of the eye, too.
Like what sort of parts?
Well, we're talking about things like the iris, that's the colored part, the uveal tract, which is a deeper layer, the vitreous humor, that kind of gel-like stuff inside, the retina at the back, the lens, even the eyelid sometimes, essentially anything beyond just the surface layer. These injuries can involve the really delicate inner workings of the eye, which is, well, why they're so serious.
That really underscores just how vulnerable the eye is, doesn't it? So let's talk about how these things actually happen. What are the typical ways pets get these injuries?
We generally see two main ways these injuries occur. The first one is sharp trauma, pretty much what it sounds like. It involves a sharp object causing a wound from the outside in. Think of that classic scenario, a cat scratching an eye or a dog running full tilt into a thorny bush.
Right, the obvious stuff.
Then the second is blunt trauma, and this one can often be surprisingly damaging, even if it doesn't look as dramatic initially.
How so?
Well, with blunt force, the eye experiences really sudden and significant changes in its overall shape, and, importantly, the pressure inside the eye.
Okay.
What's particularly interesting here is that the actual laceration, the tear, might not even be at the exact point where the impact happened. It's more of an inside-out kind of mechanism caused by that sudden distortion and pressure spike.
That's quite unexpected. So, like, a bump somewhere else near the eye could potentially cause a tear or rupture in a different part of the eye itself.
Precisely. That rapid distortion, the pressure shifts. It can lead to a tear or even a rupture somewhere else. It's often more damaging overall than sharp trauma.
Wow. That's something to keep in mind then, even if you don't see direct trauma to the eye.
Exactly. And with both types of trauma, sharp or blunt, we always have to consider the possibility that a piece of the foreign object, like a thorn fragment or something, might remain lodged in the wound or even inside the eye itself.
Okay, so we have a better handle on how these injuries can occur. Now, what should we be looking for? What are the key signs that might tell you your pet has suffered one of these lacerations? The red flags for owners.
Yeah, the signs can vary quite a bit, depending on which parts of the eye are actually affected. But there are definitely some common things we see. Well, when we take the pet's history, the story, we often find the problem came on very suddenly, acutely.
Okay.
And like we discussed, there might be a known history of the pet being in a risky situation, exploring dense vegetation, maybe near projectiles, or an altercation with another animal. However, and this is important, you might not always witness the actual moment of injury.
That's a really crucial point. They
Oh,
could get hurt when we're not even looking, or it happens so
right.
fast. So what about the physical things we might actually observe? What are some of the telltale signs we can see with our own eyes?
On physical examination, one of the most obvious signs might be a visible change in the shape, the contour of the cornea, the sclera, or even the eyelid.
Right.
There might be swelling, we call that edema, or bleeding, which is hemorrhage. In some cases, you might even be able to actually see a piece of a foreign object still stuck there.
Okay.
But here's something really crucial to be aware of. These wounds can sometimes seal up remarkably quickly, almost self-seal.
Really?
Yeah. And in those instances, the only initial sign you might see is just a collection of blood under the conjunctiva. That's the clear membrane covering the white part of the eye. We call it a subconjunctival hematoma.
So just like a bruise on the white of the eye?
Pretty much. So even if you don't see an obvious cut, a sudden, seemingly random bruise like that on the white part of the eye could be a major red flag for a deeper injury, a hidden perforation maybe.
Wow, okay. So it could look minor, just a bruise, but actually be something much more serious underneath.
Exactly. And beyond that surface stuff, you might observe other things like abnormalities of the iris, the colored part. Maybe the pupil is in unusual shape or it's not reacting right.
Hmm.
You might see blood inside the front part of the eye that's called hyphema, or a cataract forming if the lens got hit, bleeding deeper inside in the vitreous gel,
Right.
a detached retina, or even the eye bulging outwards abnormally, which we call exophthalmia. It's a wide range of potential signs, really highlighting how complex these injuries can be.
That's a really comprehensive list. It definitely drives home how varied these things are. So we've talked about the main causes, blunt and sharp trauma, and touched on common scenarios. Are there specific factors that might make some pets more prone to these injuries? Risk factors?
Yes, there are a few things that seem to increase the risk. Pets that already have some kind of visual impairment, maybe they're partially blind.
They might bump into things more easily.
Exactly. Young, very curious, or highly excitable animals might just be less cautious exploring their environment.
Yeah, puppies and kittens getting into everything.
Definitely. Obviously, activities like hunting or running through dense undergrowth, thick bushes, that significantly increases the chance of sharp trauma. And unfortunately, fights with other animals are also a major risk factor, especially cat scratches.
Right, those all seem like pretty logical risk factors. So if a pet comes in showing some of these signs, what's going through a veterinarian's mind? How do they figure out what's really going on? What's the diagnostic process like?
Well, often the history you provide as the owner, or if you happen to actually find a foreign object near the pet or something, that can be a critical piece of the puzzle.
Makes sense.
But if the traumatic event wasn't witnessed, or if there's no obvious foreign material, then the vet needs to consider other non-traumatic reasons for similar signs. Like, could this be a spontaneous corneal ulcer that just ruptured?
Hmm.
Or sudden hyphema from a clotting problem?
Okay, so ruling other things out.
Right. But there are usually distinguishing features that help differentiate. For instance, traumatic hyphema, that blood in the front of the eye, it's almost always accompanied by those corneal or scleral lesions we talked about, or bleeding around the eye.
Oh, okay.
Traumatic cataracts often involve a visible disruption of the lens capsule itself. And a traumatic retinal detachment is typically associated with bleeding inside the eye. It's really a process of carefully piecing together all the clinical signs, like being a detective.
A medical detective, yeah. What about standard blood tests? Do those usually help diagnose these eye injuries specifically?
Generally speaking, no. Standard blood work and a urinalysis aren't particularly helpful for diagnosing the eye injury itself.
Okay.
However, they might be really important as part of a pre-anesthetic workup, if surgery is looking likely, or maybe to help rule out underlying non-traumatic conditions that could be contributing to the pet's overall state or causing similar signs.
Gotcha. So not directly for the laceration itself, but still potentially useful. What other tests or procedures might a vet consider them?
Well, cytology, looking at cells under a microscope and culturing any discharge or foreign material to check for infection are really important steps, even if there are no obvious signs of infection yet.
Right, better safe than sorry.
Exactly. And these tests might even need a brief sedation or anesthesia to get a good sample, especially if surgery is already planned. Imaging can also be very helpful.
Like x-rays?
Sometimes, but ocular ultrasound can be invaluable, especially if the inside of the eye is cloudy because of bleeding or inflammation. It helps us assess the damage to the inner structures, look for retinal detachments, and potentially identify foreign bodies hidden inside.
Okay.
And then orbital radiographs, or even better, CT scans or MRIs, can help determine the path of a projectile or identify non-metallic foreign objects like wood or plastic that wouldn't show up well on a regular X-ray.
So a whole range of tools in the diagnostic toolkit, depending on what they suspect. What about the specific things the vet does during the eye exam itself?
There are several key procedures. First, the vet will try to gently assess the nature of the impact, if it's known the force, the direction to understand which tissues might have been affected.
Uh-huh.
It's absolutely critical, though, that they avoid putting any pressure on the eye until a rupture or laceration has been definitively ruled out.
Right. Don't want to make it worse.
Precisely. They'll also assess the pet's vision by checking things like the menace response. Does the pet blink when something quickly approaches their eye,
Yeah.
and their reaction to bright light? A very thorough check of the skin around the eye and the bony socket is also crucial. Any eyelid lacerations that cross the eyelid margin or seem to go deep, those are really concerning for potential damage to the eyeball itself.
Okay.
They'll also watch the pet's eye movements. Are they normal? Any abnormalities could suggest damage to the muscles around the eye or even nerve damage.
And we touched on this earlier, but how exactly does a vet check if the eye might actually be ruptured?
Well, if they see that bleeding under the conjunctiva, that clear membrane,
The bruise we talked about.
yes, that subconjunctival hemorrhage, the vet will be highly suspicious of a scleral rupture, especially if the depth of the anterior chamber, that space of the front, looks abnormal, maybe too shallow or too deep, or if there's bleeding within the vitreous gel inside, or if the eye feels softer than normal when very, very gently palpated.
Soft eye. Okay.
They'll also carefully evaluate the pupil's size, shape, symmetry, how they react to light. A detailed ophthalmoscopy, using special instruments to look right at the back of the eye, is essential. Assess the clarity of everything inside, the health of the retina, and look again for any hidden foreign bodies.
And then there's that test you mentioned, the Seidel test.
Yes, the Seidel test. It's really important if there's any suspicion of a leak from the cornea or sclera.
That's the one where they use the orange dye strip, right?
Exactly. A sterile fluorescein dye strip is moistened and gently touched to the surface near the suspected defect. If there is a leak of aqueous humor, the fluid from inside the eye, it'll wash the dye away from that spot. And under a cobalt blue light, you'll see this bright green stream flowing away from the wound, like a little river. It clearly indicates a perforation, an active leak.
Okay.
So the takeaway here for you, the listener, is that if your vet suspects a leak, this simple test is really crucial for determining the integrity of the eye and guiding how urgently treatment, often surgery, is needed.
Okay, that makes perfect sense. A very thorough and systematic approach to diagnosis. So once a corneal or scleral laceration is diagnosed, what are the main treatment principles? What happens next?
The approach really depends on the severity of the injury and, critically, whether the structural integrity of the globe, the eyeball itself, is compromised. Is it leaking or not?
Right.
That really determines whether we might be able to manage the injury medically on an outpatient basis or if surgery is definitely necessary.
Okay.
But regardless of the specific treatment plan, good nursing care is always essential. This often includes sedation for anxious or painful pets, and definitely the use of an Elizabethan collar. The cone.
The cone of shame.
The cone of shame, yes. To absolutely prevent them from rubbing or pawing at the eye, which could obviously worsen the damage significantly.
Makes sense.
Interestingly, a procedure called a third eyelid flap, where the third eyelid is temporarily stitched across the eye for protection. That's generally avoided in the initial stages of known perforations or very deep penetrating wounds until the wound is surgically closed or stable,
Why is that?
because it could potentially put pressure on an open or unstable wound, possibly making things worse or causing leakage.
Ah, okay, that makes perfect sense. You wouldn't want to squeeze a leaky eye. So what types of injuries might be manageable medically without needing immediate surgery?
Well, non-perforating wounds, so they don't go all the way through and they aren't gaping open, the edges look like they're together, those might be treated with just topical antibiotics or maybe atropine eye drops to help with pain and inflammation. For non-perforating wounds that have maybe a mild separation of the edges, a special therapeutic soft contact lens can sometimes be placed on the eye, like a bandage. That's used along with topical medications and, of course, the e-collar.
Right.
And even some very small, pinpoint, full-thickness corneal perforations. So they do go through, but they're tiny if they have a negative Seidel test, meaning no active leak is seen.
The Green River test is negative.
Right. And the anterior chamber looks formed, and there's no iris or anything sticking out.
Mm.
In very calm or sedentary patients, these might sometimes be managed medically with a contact lens, strict e-collar use, and very, very close monitoring. But that's a specific scenario.
Okay. And what about how active the pit can be during this kind of medical management?
Strict activity restriction is absolutely crucial. Non-negotiable, really.
Okay.
For cats, this usually means staying strictly indoors. No outside access. For dogs, it means only very controlled leash walks for bathroom breaks until the eye has had a good chance to heal.
Makes sense.
And a harness is generally preferred over a neck collar during this time.
Why a harness specifically?
To minimize any pressure on the neck. Pulling on a collar can potentially increase pressure within the eye, which you definitely don't want with a healing wound. It could increase the risk of it leaking or opening up.
That's a really helpful practical tip about using a harness instead of a collar. Good to know. What kind of information should pet owners be prepared for if their pet is being treated for one of these lacerations? What should the vet tell them?
Thorough client education is paramount.
Yeah.
It's so important. Owners need to be clearly informed that the full extent of the injury might not be obvious right away.
Like what?
Well, things like the potential development of cataracts, or retinal detachment, or even a deep infection. These things might not become apparent for several days or even weeks after the initial injury occurred.
Wow, weeks later.
Yeah, sometimes. And because of this, long-term follow-up veterinary appointments are often really necessary to monitor closely for these potential delayed complications.
So even if the eye looks like it's healing well initially, there could still be underlying or later onset problems that need watching.
Okay, what about the injuries that typically do require surgical intervention? When is surgery usually the way to go?
Generally, any full-thickness corneal laceration that has a positive sidal test, so it's actively leaking.
The green river is flowing.
Exactly. Or wounds where the iris or other internal structures are prolapsing, kind of sticking out of the wound, those need surgery. Full-thickness lacerations of the sclera, the white part, or wounds where both the cornea and sclera are involved definitely need surgical exploration.
Okay.
Also, any suspected retained foreign bodies within the eye or a suspected rupture at the back of the eye, those require surgery. And even non-perforating wounds that are significantly gaping open or look very deep, those generally need surgical exploration and repair to close the wound properly and try to restore the eye's structural integrity.
Right. And are there situations where surgery might be sort of considered as an option, but maybe isn't absolutely mandatory right away? Yes, there are some cases where surgery might be considered maybe not essential for saving the eye, but it could provide better support for healing.
For example.
Well, maybe those small, full-thickness corneal lacerations that have a negative sidal test and no prolapse, or large lacerations of just the conjunctiva, the surface membrane, and even some partial thickness corneal or scleral lacerations in very active patients. Sometimes surgical repair is considered just to provide more stability and promote faster, more reliable healing in those cases.
Okay, so it's a very individualized decision based on the specific wound, the patient, lots of factors. Let's shift gears a bit and talk about medications. What are the main types of medications used in treating these kinds of eye injuries?
We primarily use a few categories. Antibiotics, obviously, to prevent or treat infection. Anti-inflammatory medications to manage the swelling and inflammation. Mydriatics, which dilate the pupil in certain situations, and analgesics for pain relief.
Makes sense. Let's break those down. Antibiotics first. How are they chosen?
The specific choice often depends on whether the wound is penetrating or perforating, and how deep it is. For penetrating wounds where there isn't an active leak, just topical antibiotics, eye drops, or ointments are usually sufficient.
Okay.
However, for perforating wounds, especially those with a positive sidal test, we often add systemic antibiotics as well, given orally or sometimes by injection, just to provide broader coverage against infection getting inside the eye.
Right, covering all bases.
Exactly. Specific antibiotic medications that might be used include things like neomycin, polymyxin B, bacitracin, often in combination, or gentamicin, ciprofloxacin, cefazolin, tobramycin. There are various options.
Okay.
It's just important to remember that complicated wounds, like those involving plant material or wounds caused by blunt trauma, seem to carry higher risk of infection developing.
Got it. What about the anti-inflammatory medications? How are they used?
Topical corticosteroids, like prednisolone acetate or dexamethasone eye drops, are often very helpful to control inflammation, but usually only after the wound has been surgically closed or has started to heal over nicely, and provided there's no active infection brewing. You don't want steroids on an open, infected wound.
Right.
Systemic corticosteroids, like oral prednisone pills, might be used for more severe inflammation, especially when deeper structures within the eye are involved, or sometimes even if there is an infection. But the inflammation itself is so severe it's threatening the eye. It's a balance.
Okay.
And topical nonsteroidal anti-inflammatory drugs, NSAIDs, can also be an alternative, maybe if corticosteroids are contraindicated for some reason.
What about those mydriatic medications you mentioned? Why dilate the pupil?
Mydriatics, like atropine drops, help to dilate the pupil. This can be beneficial if there's significant constriction of the pupil, which often happens with inflammation inside the front of the eye, a condition called miosis.
Mm-hmm.
Dilating it can relieve pain from muscle spasm and also help prevent the iris from sticking to the lens, which can be a complication after injury or inflammation.
Okay. And finally, pain management. These injuries must be painful.
Oh, absolutely. They can be very painful. So analgesia is crucial. A variety of pain relief medications can be used. It might range from topical atropine, which helps with spasm pain, and maybe oral aspirin in some cases for milder pain, up to stronger medications like carprofen, which is an NSAID, or tramadol, bitorphenol, even oxymorphone, which are opioid-type drugs, for more severe discomfort. And we always have naloxone available to reverse the effects of those narcotic analgesics if needed. Those side effects are usually manageable.
Okay. Are there any specific medications that should generally be avoided in certain situations with these eye lacerations, contraindications?
Yes, a couple of key things. Topical ophthalmic ointments are generally not recommended for perforations that have a positive sidal test. So an active leak, at least not until the wound has been surgically closed, the ointment base could potentially get inside the eye.
Ah, okay. Drops instead of ointment for leaks.
Usually, yes.
Yeah.
Also, systemic ciprofloxacin, which is an antibiotic, should be used cautiously or avoided in very young, growing dogs of certain breeds and ages, because there's a potential risk, though low, of damaging their developing cartilage.
That's important specific information to be aware of. Are there any other general precautions we should know about when using these types of eye medications?
Yes. A few things to keep in mind. Some aminoglycoside antibiotics like gentamicin or tobramycin, when used topically, can occasionally be a bit irritating to the cornea and might potentially slow down healing slightly if used very frequently or at super high concentrations. Atropine, while helpful for pain and pupil dilation, can worsen conditions like dry eye if the pet already has it, and it can also increase pressure in eyes prone to glaucoma. Topical or systemic NSAIDs should be used cautiously if there's significant bleeding in the anterior chamber, the hyphema, as they can potentially affect clotting slightly. And the safety of topical NSAIDs in cats hasn't been studied quite as extensively as in dogs.
Right.
It's also worth noting potential drug interactions. For example, systemic NSAIDs might increase the risk of kidney toxicity if used at the same time as certain systemic aminoglycoside antibiotics. So the vet needs to consider the whole medication picture.
Makes sense. Lots to consider when choosing medications. What about the follow-up care? Once treatment starts, how often do these pets typically need to be re-examined?
The frequency of follow-up appointments really depends heavily on the initial severity of the wound.
Okay.
Deeper or longer penetrating wounds that haven't been surgically closed, as well as pretty much all perforating wounds, they typically need to be rechecked very frequently in the beginning, often every 24 to 48 hours initially.
That often?
Wow. Yeah, to ensure that the eye's structural integrity is being maintained, that it's not leaking, to monitor super closely for any signs of infection developing, and to assess how well the inflammation is being controlled by the medications.
Cool.
More superficial penetrating wounds might be rechecked maybe every 3 to 5 days until they've healed nicely. And it's also absolutely crucial to adjust the antibiotic therapy if we get results back from any cultures that were taken initially to make sure we're using the most effective medication for any bacteria present.
Right, tailoring the treatment. And finally, thinking about prevention. Are there any practical steps that you, as a pet owner, can take to help prevent these kinds of eye injuries from happening in the first place?
Well, obviously, it's impossible to prevent every single accident. Pets will be pets.
True.
But there are certainly some precautions that can help reduce the risk. When introducing new puppies or kittens into a household with adult cats that still have their claws, it's always wise to supervise their interactions very closely, especially initially. Minimizing your pet's unsupervised access to areas with really dense vegetation, like thick woods or thorny bushes, can be helpful. And if they do spend time in such areas, maybe considering a gentle saline eye wash afterwards, just to flush out any potential debris like seeds or dirt, might be beneficial. Doesn't hurt.
Okay.
And for pets that have known visual impairments or are completely blind, It's a really good idea to limit their access to potentially hazardous environments and try to keep their immediate surroundings, like inside the house, fairly consistent so they can navigate safely and avoid bumping into things.
Those are some really practical and actionable tips for pet owners. Good things to keep in mind. What are some of the potential long-term complications that can happen with these eye injuries, even if they get appropriate treatment?
Yeah, unfortunately, even with the best possible care, there's always a risk of some degree of permanent vision loss. And in some very severe cases, sadly, loss of the eye itself might be unavoidable, either because it can't be saved or because it becomes chronically painful or blind. Chronic inflammation or ongoing pain in the eye can also develop as a long-term complication. And specifically in cats, although it's considered rare, there is a very serious potential complication called post-traumatic intraocular sarcoma. It's a type of aggressive cancer that can develop inside the eye months or even years after severe eye trauma.
Wow, that's a sobering thought, especially for cat owners. So putting it all together then, what's the general outlook? What's the prognosis typically like for pets that experience these corneal and scleral lacerations?
The prognosis really varies quite a bit, depending on a number of factors we've touched on.
Right.
Generally, most eyes with corneal lacerations, especially if they're not perforating, or those with just retained corneal foreign bodies that can be removed. They can often be successfully treated, and vision can be saved. The outcome is often pretty good for those.
That's encouraging.
However, the further back in the eye the injury is located, so involving the sclera or deeper structures, the less favorable the prognosis generally is for maintaining vision. Injuries involving the sclera or the uveal tract, a complete lack of light perception when the pet is first examined, perforating injuries that involve the lens, or have significant bleeding inside the eye, or detached retina. All of those carry a poorer prognosis for vision.
Right.
And as a general rule of thumb, penetrating injuries tend to have a better outcome than perforating ones. And injuries caused by sharp trauma often have a better prognosis than those resulting from blunt force trauma, which can cause more widespread internal damage.
Okay. Well, this has been an incredibly informative, really detailed deep dive into corneal and scleral lacerations in our pets. It's very, very clear that these are serious injuries. They absolutely demand prompt and expert veterinary attention.
Absolutely. I think the crucial message, if there's one thing to take away, is that the sooner a potential eye injury is recognized and the quicker appropriate veterinary care is sought, the better the chances are for a positive outcome, for saving vision and the eye itself.
And while we've covered a significant amount of ground today, it's so important for you, our listener, to remember that this deep dive provides a solid foundation, some good background understanding. However, any suspected eye injury in your pet, seriously, no matter how minor it might seem at first glance, truly requires immediate professional veterinary evaluation. Don't wait and see with eyes.
Which leads us to a really important point for you to consider now. Given just how active and, let's face it, sometimes clumsy many of our furry companions are, what specific adjustments could you realistically make to their environment or maybe their daily routines to potentially minimize the risk of getting these kinds of eye injuries?
Good question.
And also, knowing now that even seemingly minor trauma can unfortunately have delayed and serious consequences down the road, what proactive steps can you take to ensure the early detection of any potential eye problems in your pet?
We really encourage you to observe your pets closely, get to know what's normal for their eyes, and always, always err on the side of caution if you have any concerns at all. Get them checked out. Thank you so much for joining us for this deep dive.